Joe, do we need to do anything to transition from the practice session to the active webinar?
Sorry, my microphone was off.
Practice session to the active webinar.
Oops, no, you don't. Sorry, that was YouTube playing in the background. We're all good. We're broadcasting and we're also streaming as we speak.
Hey guys, we'll be getting going in a few minutes, but we're going to just wait for a few more participants.
Here we go. Okay, we're gonna get going. Hi everyone, I'm Katie. My pronouns are she, her. I'm in the class of 2022.5.
And I'm Emma Pagney. I use she, her pronouns, and I'm the class of 23.5.
And we're the SGA Directors of Health and Wellness. So we're just gonna get us started here. Essentially, we just also wanted to note before we really get into it that we want to be resources for you all this year as well. Our sort of first order of business is this COVID panel and trying to get you guys some more information. But definitely feel free to reach out to Emma or I or both of us if you guys ever have any questions or want to come up with any ideas, anything like that. As SGA, we're here for you guys.
Yeah, and the purpose of this panel is really just, to serve as an outlet for support, information, and questions regarding campus's strategy towards facilitating a safe environment on campus this semester. But without further ado, I guess we can get started with our speakers. So we're going to send it off to the Vice President of Student Affairs, Smita.
Thank you all. And I have to start by saying I apologize, but actually I don't apologize. This is the life of a working mom. This is our guest speaker today. Hopefully he won't do a lot of speaking. This is my son, Rohan. Can you say hi? Rohan wants to join us. We're having a little bit of issues staying in a different room, so that's why he's here. And hopefully he will not add any color commentary to my remarks. But I want to first thank SGA for hosting the student town hall. I realize that for some of you, this might be your first time hearing and meeting me. I hope that we will continue to meet and hopefully even see each other in person. But I look forward to engaging in a conversation today around sort of the college's philosophy and current practice in terms of all things COVID-19 related. I want to start by really providing you with sort of a high level update as well as rationale for where we are today and how we have approached opening campus for this semester in the context of the COVID-19 pandemic. The first thing I think I want to say, and you might hear me say this a lot, is that as a college, we are really trying to think about COVID-19 in a different frame than where we were last year. It is only natural for many of us, and I was part of this also, to think about COVID-19 in the context we were in last spring. But there is a lot that has transformationally changed in us dealing with this pandemic. And one of the biggest game changers has been the vaccine, and of course, our high vaccine rates. So one of the things I would ask you to do is, as you approach this conversation, as you think about our current stance, I would ask you to sort of, if you can, join me in what I call a shifting of the mindset in terms of the COVID-19 pandemic, based on the fact that we do have a huge change with the vaccines. So having said that, I think what I would like to offer is, as we started our journey in the summer planning for the fall semester, we were confronted with high vaccination rates, constantly growing vaccination rates around the country, around the state, as well as our Addison County. We then put in place a vaccine requirement, which is similar to many of our peers and campuses across the country. And we also then thought about other mitigation strategies. We realized in the midst of the summer that we were dealing with the unexpected when the Delta variant started sort of hitting different places around the globe. And then we really saw it at our home here in Vermont. The Delta variant changed a lot of things and our thinking around COVID, and we knew that there was an increase in risk exposure as well as breakthrough cases. However, the whole time and still today, we continue to really be guided by the CDC, the Vermont State Health Department, as well as our firm belief in all the scientific facts that we are getting from public health experts around the country and the globe. So as we look to the CDC and the Department of Health for guidance, what we were told and what the guidance still continues to be is testing, especially regular testing of vaccinated individuals is not a recommended practice. It can lead to false positives. It can also, in college settings, lead to a sort of suspension of sort of a shared community responsibility in terms of mitigating risks. Now, this last point that I made is not sort of a research point, but one of the arguments that our public health experts have said is that sometimes regular testing can create a false sense of comfort and can actually alter some of the behaviors we are trying to encourage the community to sort of continue to help us with, which is risk mitigation. And so we continue to look at the current CDC guidance, which firmly says that it is not recommended for fully vaccinated folks to get tested regularly. You might argue that most of our peers, if not all, are doing some sort of regular surveillance testing. I want to unpack that a little bit. As I have spoken to my NESCAC peers, as well as institutions around the country, not all institutions are doing blanket surveillance testing once, twice, or 3 times a week of their entire student population. Many are choosing smaller pooled testing, random testing, and testing of just smaller pockets of students. And the other piece that I also want to say is these peers that we often look for best practices, for figuring out comparable practices, they all are not in the state of Vermont. So as we are making this decision around testing, we were looking at our peers, but we were also looking at our peers here in the state of Vermont. And what we found is institutions here in the state of Vermont are also not testing fully vaccinated individuals like us, based on guidance from the Department of Health. Having said that, we have always been in the position to pivot and be nimble and change our stance and pivot to surveillance testing if needed. That didn't work. I was hoping that would work. If needed, if we saw our prevalence rates go up. But right now, our decision to not do widespread surveillance testing is really based on CDC recommendation, as well as the low prevalence rates in the state of Vermont. I also want to sort of address the narrative that we have no capacity or no options for asymptomatic testing for vaccinated individuals. We absolutely have open slots available for anyone who is vaccinated, who is wanting to get tested if they're asymptomatic. Those slots are available currently on Monday, and we are exploring and are pretty close to offering another day of testing. I think we'll be able to firm up those dates in the next couple of days. We're offering close to 200 slots for asymptomatic testing for students who are just interested in getting tested. What we have found is that there have not, these slots have been open, and we are not feeling an overwhelming need to create or increase our number of spots. So there's plenty of spots. So for example, what I understand is today, which was Monday, which is when we offer the asymptomatic testing, we had about 64 open slots still available at the end of the day. So there are plenty of opportunities for students if they wanted to take the tests if they're asymptomatic. The other piece I want to also highlight is, thanks to the great work of our staff in the Student Health Center, we are actually offering symptomatic testing pretty much all week long, which is different than what we were doing in the spring. And we decided to put our resources and really channel our energy also on symptomatic testing, because we knew that as we got into the fall, we were going to anticipate higher rates of just upper respiratory illnesses, colds, flu season, the usual kind of college crud, as Dr. Fauci once said, referring to sort of the virus and respiratory pieces that come with the beginning of the semester. So we anticipated that we were going to have a lot of students who would have symptoms that are those that are often experienced by people who are positive for COVID. And so we are offering symptomatic testing to students, and a lot of our students have been utilizing that, and that is happening all week long. So again, want to clarify the whole, our testing strategy. It is not that we're not doing any testing. We are being very strategic and intentional around where we are focusing on our testing. We also know that as we move into this academic semester, the mindset shift is also based on a large part of our students and their parents and families wanting to return to as much of a normal routine as possible. Now, I always say normal is just a setting on the dryer. I don't think we can get back to whatever it was as we described normal pre-pandemic. We are absolutely in the midst of a pandemic. I don't want to be perceived as saying we are underplaying the pandemic, but we are also now beginning to do some things that we used to do pre-pandemic. And many of our students want to return to some of the student experiences that they have so craved in the past year. So we are balancing both the health and well-being of our students with also a real intensity and a real desire to offer activities that were restricted or were just not able to happen last year. And so we are really trying to also balance that student experience. I feel like I've talked a lot, so I will pause. I look forward to answering your questions, but I'm joined today by some great colleagues who, unlike me, were with you in this journey last year and have been working really hard to prepare for the opening this year and this semester, and are working constantly to support our students. I'm going to start with turning this over to my colleague, Barbara Mccall, who is the executive director for our Center for Health and Wellbeing. Barbara, of course, is very close to all of our testing strategy. Her staff have worked tirelessly these past few weeks, taking care of our students. So first of all, if you can give a shout out, a virtual shout out to Barbara and the team, I would really appreciate it. Barbara, take it away.
Great. Thank you, Smita, and thank you, Rohan, too. It's really wonderful to be with you all here tonight. Again, as Smita said, my name is Barbara Mccall. I use she, her pronouns, and I serve as our executive director for the Center for Health and Wellness, which is all 4 of the student health serving offices: health services, counseling, health and wellness education, and sports medicine. Smita did a really great job talking about some of our testing strategies and our overall philosophy around our approach to COVID-19 this year. And so I just wanted to highlight a few key pieces of information that I think may be answers to some frequently asked questions or frequently thought of curiosities. So Smita mentioned that we are doing what we call prevalence-based surveillance testing, which means as prevalence, which is another way of saying the number of COVID cases in any community goes up, we then increase or scaffold up our testing resources. And when COVID cases are low in a given community, like they are in our Middlebury community right now, then we decrease those testing resources or surveillance resources. She did mention that we have those slots available on Mondays. And I also wanted to offer a reminder that we are testing unvaccinated students regularly, those with exemptions, as well as portions of our student athletes in order to meet the guidelines that are set by our NESCAC athletic conference. We also, as she mentioned, are offering symptomatic testing 5 days a week, an increase from last year where we had 2 days a week of symptomatic testing. So any student who had any kind of symptom related to an upper respiratory infection. And those are the CDC guidelines that we test any student who has an upper respiratory infection symptom or cluster of symptoms in order to see if it could be COVID-19. And so we offer testing Monday through Friday. Students can access that by calling 3290, that's our nurse triage line, and they can talk to a nurse, get screened, potentially have an appointment for testing made, or they can certainly call the front desk as well at 5135. Folks have had a lot of questions about what does it mean to get tested, the instructions that we give students, and certainly that students would get if they went over to the urgent care resources at Porter Hospital, or that us as employees, as faculty and staff would get if we saw our healthcare providers, are the CDC recommendations that if you have symptoms and you got tested for COVID, that we are meant to stay home. And for you all, that means in your rooms or suites or townhouses or homes until we get those test results back. One of our best tools on top of vaccination and masking indoors is staying home when we don't feel well, especially if we are waiting for COVID-19 test results. So I just really want to offer that reminder that that's a way that we can protect ourselves, protect each other, and that faculty, staff, and hopefully your peers are getting used to the fact that we can kind of take a break and care for ourselves. It takes about 2 days to get test results back. And for students that get tested on a Friday, those results come back over the weekend and they get them Monday morning, which is nice and quick. So still only 2 days. And we want people to be practicing self-care, hydrating, taking the opportunity to get well, whether or not COVID-19 is what they have or some other cold or virus. I also wanted to offer just a couple reminders about masking indoors. I know folks have been getting used to this for quite some time now. And now that cold and flu season is here, the weather is changing and we're seeing other kinds of illness on campus. Masking not only protects against COVID-19, but also common colds and the flu. It's really important that folks are wearing them indoors, certainly in classrooms, at events, in places where we know that it's required, but also anytime that you are with others in large events, crowded spaces, or you're not with your close contacts. The more we can reduce what we call the cold and flu burden this cold and flu season, the more freedom we'll have on campus to be out and about. The fewer people will have symptoms, which means the fewer symptomatic tests that we have to do and the fewer people who need to take a couple days to be in self-care in their room awaiting those test results. So those were a few of the reminders that I wanted to offer to folks. I'm really looking forward to hearing what some of your other questions might be and happy to talk about other health issues if they are coming up or are feeling really related to COVID-19 these days. So with that, I think I'll turn things over to my colleague, Derek Doucette, who serves as our Dean of Students.
Thank you, Barbara. Hello, everyone. My name is Derek Doucette. I use he, him, his pronouns, and I serve as the Dean of Students. And I'm going to touch upon 3 areas in which this paradigm shift that Smita described from living in a state of crisis, in a state of emergency, to a much more normalized, if I can use that word, paradigm in which we're living with what effectively is going to become an endemic illness on our campus and in the world. How that plays out, that paradigm shift plays out on the ground in a number of areas, 3 in particular. So the first I want to touch upon is our isolation and quarantine housing. And I've heard a narrative out there that we have insufficient capacity or that we're not doing these things this year. And I want to dispel that narrative, but I'll start by just making sure that we define our terms. I think we all know, but I'll just make sure that isolation is isolating oneself from one's peers when one has tested positive for an illness, in this case, COVID-19, until you're no longer infectious. Quarantine, on the other hand, is staying away from your peers when, well, there are a whole host of reasons, but when you believe you might have been exposed, when you are a close contact of a known case, when you have other high-risk reasons that you might be concerned about exposure, for example, significant travel or attendance at a large, densely packed event. So we do have the capacity to accommodate both of these needs. We have isolation space at each of our 3 major residential locations, the main campus, the Breadloaf campus, and I'll call it our in-town satellite campus, the Inn on the Green and Marriott. We have space at the Inn on the Green for isolation as well. We do have designated quarantine space set aside, but this is an important area in which this year is very different, and it's because we have a highly vaccinated population. We're at about 99% student vaccination right now, which is fantastic. And the CDC's guidance is that students who are fully vaccinated, even if they are close contacts of a known positive case of COVID-19, don't need to quarantine. And that's a total sea change from last year. The guidance there is that they'll wear masks and be tested 3 to 5 days after exposure. But what this means on the ground is that the vast majority of our quarantine needs are effectively eliminated for the time being. That guidance could certainly change. We respond. So I just wanted to clarify that we do have capacity built into the system. It's meant to meet a different array of needs and CDC guidance, but it is there. The second area I wanted to touch on is conduct. And I know that this was a really challenging area for students last year when we had a very thorough health pledge and We were reacting based on the governor's requirements for us to do so very quickly and frankly, very forcefully in the face of violations to that health pledge. This year, we no longer feel that that is necessary, and the governor no longer compels us to react in quite the same ways. And so we are back to our standard general conduct policy. That's back in effect. It doesn't mean that there are no COVID-related behaviors that might elicit a conduct response. It just means that we're not going to address them through that temporary administrative process that we had in place last year. There are some behaviors, for example, missing multiple required tests because some students have testing requirements, multiple flagrant mask violations because wearing well-fitting face coverings is still among one of our most important mitigation measures. Violating the visitor policy, for example, by having a guest from off campus in your residence halls overnight. Those are examples of behaviors that would probably still elicit a conduct response from us, but it wouldn't be under that temporary administrative policy that we had in place last year, under which, frankly, students were removed from campus. So that has been rescinded, and we're back to a much more normal conduct framework. And then finally, in the area of programming and event planning and hosting, last year we took a highly prescriptive approach. We were learning as a community about how to run safe events, and we felt the need to be very prescriptive in the ways in which those events could be structured, in the mitigation measures that were in place, in the group sizes. And we've taken a much more measured approach, again, based on the public health situation on the ground. We're a highly vaccinated campus. We do not appear to have a high prevalence of COVID-19 virus on campus this time, so that's really encouraging. And what we're doing now is asking event hosts, because at this point we've all become well versed in our COVID mitigation measures, we're asking event planners and event hosts to carefully consider the mitigation measures that they'll put in place. And so that might mean, well, at the baseline level, that means we're highly vaccinated, which is great. But then well-fitting face covering in indoor settings or densely crowded outdoor settings. I'm imagining many of you probably attended the concert on Friday night, and there was a mask requirement there. So I think that was a useful model as you plan your own events to think about what effective mitigation measures ought to be in place. That might include distancing where feasible, although that's not necessary per se if you're masked in a highly vaccinated environment. It might entail a mask mandate at your events, even if they're outdoors, if they're sufficiently dense. And so the new approach to programming is to trust in the wisdom and the lived experience that we've all had over the last 18 months to plan safe events. We all know how to mitigate COVID-19 risk now. Fortunately, the Event Management Office is ready to support you in that process. But we're stepping back and taking a less prescriptive approach to event planning and event management. So those are the three areas I wanted to touch on: our approach to isolation and quarantine and how it's different, our approach to conduct and how it's different, and how our approach to programming and events has also evolved as the pandemic has evolved. And I think I'll stop there and I'll turn it over to our SGA friends for some question and answer.
Okay, guys. So we have a few questions that we're going to just kind of read them aloud, and then our speakers will answer them for us. But our first one is, how will the college make students safe after fall break or Thanksgiving? Will there be tests for everyone?
I can start with that. We are actually currently talking about that, and there will be an announcement and a change in the campus status page soon. Our current posture, again, is that we will not be testing everyone. However, we are going to increase the slots for asymptomatic testing for students who may want to come and get tested after they come back from fall break. We are recommending, and in terms of our required related testing for students who are required by either athletics or unvaccinated students in terms of guidance for travel, we will be requiring testing how can you resist getting a little kiss from a friend as you're answering questions about quarantine? But we will be providing more test options for vaccinated asymptomatic students if they want to do that. So more details around how many, when, will be shared with you shortly. But we will most likely open up more days following the days after fall break. Derek, Barbara, is there anything you would want to add?
Yeah, I would just like to add one thing. I just want to address the framing of the question, and that's that this idea that testing makes us safe, and that's probably an unintended vibe to that question. But I want to make sure that we all understand that it's actually the behavioral choices we make that make us safe when we leave campus or when we're here. It's when we go home for holidays, being smart about whom we interact with and how we interact with them, and taking precautions when we do. So testing is just a moment in time. It's a snapshot, and it's not testing that makes us safe. It's those choices that make us safe. And so I just wanted to touch on that.
I would just add that I think many of us may not have traveled for a while. And so we're working on some information and some support that really clearly lays out some ways to stay safe during, before, and after travel so that folks can make choices that really fit their needs for our upcoming breaks, their families' needs. And so stay tuned for some more information coming out from Health and Wellness Education about safe travel and risk reduction around travel.
Awesome, thank you. Another question we have is about the quarantine policy right now. And someone asks, do students quarantine 10 days when they first test positive? Do they need a negative test to leave the quarantine?
This is a great question. So Derek set us up really greatly to have this question answered, talking about the difference between quarantine and isolation. So quarantine is what people do when they are awaiting test results or awaiting more information about their status. And isolation is what people do when they have tested positive for COVID-19. We're sure that they have it. So let me start with quarantine, then we'll move to isolation. So for students who are fully vaccinated, there are no quarantine requirements currently, either related to travel, international, domestic, or if they find out that they are a close contact of somebody that has COVID-19. So for folks who are vaccinated, nothing that they need to do. If they develop symptoms, we do want them to get tested immediately right away, and then they'll quarantine until they get those test results. For folks who are unvaccinated, who have been identified as a close contact of somebody who has COVID-19, those folks are required to quarantine based on CDC guidelines. And so for students who might find themselves in that position, we would work with Derek's team, get them into quarantine housing, and make sure that they have the support that they need. When it comes to isolation, those are folks who test positive for COVID-19. And we can kind of split those two experiences up into two categories. One is for folks who have symptoms, and one is for folks who don't. So for folks who are experiencing symptoms congruent with COVID-19, they're going to be in isolation for 10 days. In order to leave isolation, two other things need to happen. They need to have been 24 hours without a fever on their own, not with fever-reducing medication, and their symptoms need to be improving. And that's really to say if someone's symptoms are staying the same, they're not getting any better, or if, hopefully this isn't the case, but if they were to get worse, we would want to continue to monitor that person and take really, really close look at what's going on with them. And so they would stay in isolation a little bit longer until either they went without the fever for 24 hours or their symptoms started to improve. For students who don't have any symptoms at all, which can be the case, absolutely, especially for college students aged 18 to 22, those students are also going to be in for 10 days after their positive test. We know that people can test positive for COVID-19 for up to 90 days after their first positive test. And so there's no negative test result that's required to get out of isolation. If we tested people at 10 days or even 30 days later, in all likelihood, they would continue to test positive for COVID-19. So we're not looking for a negative test result. We're looking for 10 days to have passed since their test. And if they have symptoms, that they've improved.
Awesome. Thank you, Barbara. So our next question is about the dashboard on Middlebury's website, and people are just concerned that it hasn't been updated like daily.
I can answer that. So we are starting to update it daily. We sort of made that shift at the end of last week. Excuse me. There are some just back of house IT pieces that we're trying to smooth out. It looks like, and I am not an IT professional, but it is pulling data daily, but for some reason, there are some dates that are not aligning. And so it's causing some confusion. So we're hoping to resolve those, but the dashboard is being updated daily.
Great, thank you, Smita. Next question, we just have a couple more. Someone is asking about staying safe and contact tracing in the dining halls, especially just with the high occupancy and congestion of students in the dining halls, and us obviously being able to take off our masks to eat. So I don't know if anyone is able to comment on that, but knowing about that and contact tracing, and especially if symptomatic students aren't required to go in for testing, or like if that's not being enforced.
I can take that one. So I'll start with the students who have symptoms. It is an expectation in our community that if we have symptoms, faculty, staff, or students, that we're getting tested. Students through health services and faculty and staff through our healthcare providers. So I want to be clear about that. And then secondly, we are really lucky here at Middlebury. We have professional trained contact tracers that are on staff in the Center for Health and Wellness, who have taken online courses and done lots of extra training to be able to do some of the epidemiological research that it takes to have what we call contact tracing interviews with students who test positive for COVID-19. It might be helpful to review the definition of a close contact, which is someone with whom we have spent 15 minutes or more within 6 feet of in a 24-hour period. That counts if someone has been within 6 feet of one other person for 5 minutes, and then 5 more minutes, and then 5 more minutes, but it all happened within the same 24 hours. And certainly when we sit next to people to eat, we tend to be within 6 feet, and we tend to be with them for 15 minutes or more. So when we are reviewing with people who might be their close contacts, we are absolutely asking about meals, whether those meals are taking place inside, outside, in a residence hall, in a dining hall. We're sort of trying to draw a 6-foot circle around that person and figure out who may have been a close contact. We aren't asking folks to do contact journaling anymore, but I still think it's a really good practice to sort of find a way to track who we've been eating with, who we're studying with, who we're hanging out with. It can make contact tracing go really quick and make it more accurate, which means that we have a better chance at preventing the spread of COVID-19 in our community. So if somebody is thinking back and they're trying to figure out who may be a close contact, they're going to have a healthcare professional working with them, asking them really good questions to help them figure out who those folks might be. And we really are paying attention to that 6-foot circle. So somebody who was at the next table or at the end of a long table would not be considered a close contact. Unless it was a super, super long line. Somebody you stood in line next to would not be a close contact. So I think sometimes we start to get a little anxious and think, oh my gosh, maybe anybody that I came into contact with is a close contact, but we're really focused on that definition of within 6 feet for 15 minutes or more within a 24-hour period. And we have folks who are trained to work with students to help them recall what was going on. It's also the case that sometimes we forget, and it might come to us a day later or 2 or 3 days later. And so for folks who test positive for COVID-19, we make sure that they have access to our staff in an ongoing way. So if they remember something that they ate with somebody different, or they forgot that they went on a walk with someone, we welcome that information, and we do what we call ongoing or rolling contact tracing to make sure that we're reaching out to folks as accurately and as quickly as possible.
Awesome. Thank you, Barbara. So our next question is about just like the option of the campus implementing hybrid courses. So how many confirmed cases would it take for the school to implement that?
I'll start us off, and then I would love for my colleagues to jump in. Do you want to answer that? No, it is a complex question. So, I know that for many of you, you're probably looking for a really specific and clear criteria for when we may pivot in terms of hybrid or remote instruction and operations. Unfortunately, we are not conceptualizing a shift based on a specific number. And here's why. We could have, I'm making up this number, we could have 10 cases, and it would look differently in terms of how those 10 cases came about. If there were 10 cases who were all from, say, one particular floor of a residence hall or residential facility, that would trigger us to be asking a different set of questions versus 10 cases that may be sort of all over the student population and may not have any kind of common connections. And so we are hesitant, and public health advice tells us not to sort of put a number to when we change our operations from all in person to hybrid to remote. We would have to look at all the factors in terms of rising case counts, prevalence in our community. There are a number of factors that would go into sort of making that decision. And it would be, in most cases, but I don't want to promise this, but in most cases, it's a slight sort of turning up the volume versus just going from 0 to 10, right? But again, I don't want to say that will always be the case, because we know that we could have overnight a large number of cases, or we could see a slow growth. And so our approach will vary based on the nature of the cases and how that exposure is happening. We could also, start putting some more restrictions if we start seeing a rising prevalence rate in our community, not necessarily even on campus. If we, for some reason, start seeing alarming numbers in just Addison County, we may put a few other mitigation measures in place. And so I think there's going to be a number of factors involved in terms of when and if we make that decision. So I guess what I would want to say is it would take a lot of thoughtfulness and intentionality. I invite my colleagues to maybe add on to that.
I would just add a reminder about our vaccination rate, that is one of the strongest strategies that we have right now. And so that makes Middlebury a really safe place to live, learn, work. And with our really high vaccination rate, it's unlikely for us to see a lot of breakthrough cases. We are one of the most highly vaccinated sort of sectors or industries in the state of Vermont, and the state of Vermont is one of the most highly vaccinated states in the country. It doesn't mean that we won't see cases. We know that we will, and that we are, and that we're going to live with those. And we know that there's also a significant amount of safety. And so if that were to change, if we were starting to feel like, as Smita said, there needed to be new protocols or practices, or we needed to invite back some of the behavioral expectations we've had success with in the past, those would be communicated to the community swiftly, clearly, and we would make connections between our goals and outcomes and why we were asking folks to change their behavior.
Awesome, thank you. Another question we have that just came up is about Parents Weekend or Family Weekend. And the question is, are family members required to be vaccinated for Parents Weekend? I would just add to that, are they required to be like getting tested or anything? And then what is the policy on visitors in general?
I'd be happy to take this one. So visitors are expected to be vaccinated for Fall Family Weekend. That is a requirement that our friends and alumni and parent programs have publicized widely. So that's for that particular event. And our policy on visitors and guests in general is that at present, they're not permitted, with one important exception. And that exception is for officially sanctioned and vetted college events, visitors may be permitted. And that's how we ended up with, for example, Fall Family Weekend going on. And the distinction I want to draw here is that the events for which visitors are permitted are carefully planned and carefully considered with mitigation strategies, such as a vaccination requirement in place. And not just a vaccination requirement, but then the events that those folks will attend have been looked at on an individual level to minimize the risk of transmission. And so that's the distinction. Carefully vetted and carefully planned events are a reasonable context in which to have visitors. Just having visitors at this point, and this could change, and we certainly hope it will, but at this point, having visitors in a less structured environment doesn't seem like a reasonable choice to us. And again, we hope to be able to change that, but that's where we are now.
Okay, awesome. So our next question, is kind of about, I guess, just like student integrity and expectations with upholding community safety. So this particular student or professor is just concerned about students or community members breaking rules and asking, like, is it their duty to report them or report if someone's symptomatic? Do you guys have any thoughts on just kind of the general, I guess, process for going about like witnessing broken rules?
Sure, I can start us off, and I would invite others to join in as well. So I would first say that I think we all bear a responsibility to have respectful conversations with one another when we see one another making choices that are contrary to our community expectations around COVID-19 or anything else for that matter. The same things apply to violence prevention on our campus and any number of other areas. And so I would say first and foremost that, yeah, it's an expectation that we respectfully engage with one another in those moments. Now, we all know that that's not always going to work. And in those moments when that isn't effective, then there are supports in place. You could bring your concerns to your Res Life staff members, either student or professional Res Life staff members, your RDs. AJ Place is on this call. Christy Carpenter, I think, is here. So we have any number of professional and student staff who are ready to have those conversations with you. Your student life deans, me, members of the student activities team, depending on the context in which you're observing these behaviors. Public safety, again, we're all here to support you, but I would encourage you first and foremost to have respectful conversations with one another, because that's the best way forward. And I think that was one of the keys to our success, that students really were holding each other accountable in the best sense of the word last year to meeting our expectations. And so that's how I would respond to that. Lots of supports in place. My recommendation is that it begins with a respectful conversation. I don't know if anyone would like to add anything to that.
I absolutely agree with Derek, and I think it is a really, really tough line. But we are a community, and part of being in a community is learning to have conversations around community safety without, sort of feeling like we're in a place where we're sort of reporting on one another. I also just think it's a tough place to pass judgment on someone who may, have a sniffle. I've been battling a cold for a while, and people don't know what someone else's story might be, and so we may see someone who's coughing and may feel like they're not doing anything because they're out and about, but we don't know what is happening. So I would just invite you all to operate from a place of good intentions, and with the folks that you have a sphere of influence around, to have some meaningful conversations around, hey, I've noticed this. What are you doing to take care of yourself? So I would just really offer that.
Great, thank you. I think that is pretty much it for questions that have been sent in. There was one that we answered by typing about having more to-go containers in the dining hall. We'll pass that along to our dining colleagues, but also just to add, remind your friends to return their containers. That's some feedback that I've been getting from the dining staff already. Whenever I've asked for containers, they just say, remind everyone to bring them back. We're not getting them back. That's why they're not here. So just a note on that. And then we were also wondering, Emma and I, for our lovely panelists, if you guys have any info for students about like counseling resources, specifically surrounding like some COVID anxiety, a little bit that's been voiced here tonight, but in general too. Yeah.
Absolutely. I'm so glad you asked about that, Emma and Katie. I think, a lot of us are having a lot of feelings. Things are changing. We've been in transition, and a lot of us, it's bringing some stuff up. So we really want to make sure that students have places that are safe and confidential to talk about what's going on for them when things feel really big or when they feel small or medium sized. So a couple of resources that I want to make sure everybody knows about. One, we have our staff counselors here on campus. Students can call 5141 or email counseling@middlebury.edu to make an appointment. You can also go on the student health portal, go/student health portal, see what's available and pick a time, a day, and a counselor that you think might be a great fit for you. We also have 24/7 on-demand resources through mid-telehealth. There's a feature on there called Talk Now, and that's for anybody, anytime to connect with a licensed counselor. There's also a feature on mid-telehealth called Scheduled Counseling, and similar to our student health portal, students can go on, can read about the different profiles of local counselors, select a day and time, and they can schedule up to 3 sessions in advance. Some people like to know when they're going to go, and that can be a really great option for folks who are looking to schedule out into the future. So those are some of the options that we have available in person, telehealth based on Zoom, or on the mid-telehealth app. One other thing I'll mention about mid-telehealth that's new this year, I don't know how many folks have tried this out yet, but there are ongoing daily free classes on mid-telehealth. Yoga, meditation, also topic-specific things like managing grief and loss during COVID-19, talking to a friend if you have concerns about their mental health. And so it's great for folks to hop on the Timely Care app. That's the app that mid-telehealth runs on. To download it, use your single sign-on, your Middlebury ID and password, and you can see not only all of the services that are available to you, but all of the daily classes that are included. And for some people, they might be looking for something more like that, to do some skills-based or tool-based learning, or to just take a break, move their body, or take a break and tune into what's going on with them. So those are some of our mental health resources. And certainly if folks have questions, you're welcome to email me, to email chw@middlebury.edu, or email counseling@middlebury.edu.
And we do have one more question, so I guess we can end on this note. And thank you, Barbara, for answering our question. So our final question is, does our school purify indoor air?
I can start with this. Oh, Derek, do you want to? Derek may have a little more history on this than I do, but please go ahead, Derek.
Sure. And my history will be a little bit out of date, but we can certainly get some clarification from our facilities staff. But last year, when we embarked on this crazy journey, our facilities staff assessed the airflow and improved the airflow where necessary in, I'm not sure it was all of our buildings, but it was certainly the vast majority of our buildings. And they do things like regular maintenance where they change out the filters in the filtration systems of the buildings. And so that's something that's been very much on their minds. That information is from last year when we were laying the groundwork for a successful semester. My assumption is that it has continued. And I'd be happy to get some confirmation for you and report it out through Emma and Katie. But that work was absolutely done in preparation for last year. And so I feel confident that it was done in preparation for this year as well.
Is it okay if I were to just add a little bit to the question that is also there around professors? I don't know if we answered that fully. And I apologize if someone did and I was distracted, but I do feel like it's important to offer a couple of thoughts around, the feeling of that our professors are in great danger. So I think one of the things I want to say is there are a lot of faculty and staff that are on our campus along with our students and supporting our students. And I would say, just like faculty, we have staff who are constantly interacting with our students, oftentimes in more informal and closer capacities in a structured classroom. We have found that, and I would be hesitant to say there's like a research study out there, but as we have looked at cases, not just here, but as around the country, there is not any sort of pattern or any sort of substantive argument to be made that cases have actually come from classroom settings. In fact, we have found that most cases that have sort of happened have been outside of the classroom setting. So I do want to challenge this notion a little bit about how just because we are in a classroom with faculty, that we are putting our faculty in great danger. Again, as a campus, like many other institutions, our two greatest mitigation strategies are a highly vaccinated community. 99% of our students are vaccinated. 97% of our faculty and staff are vaccinated. We have also, as an institution, provided individual accommodations for faculty and staff who are immunocompromised. So there is a process that faculty and staff can go through in order to address those concerns. Many of us, as you saw, have young children who are not vaccinated or are unable to get vaccinated. That is a real fear. I live with that fear along with many of my faculty colleagues. But we also know that, again, vaccination and masking are two really, really critical mitigation strategies that do limit exposure and that do also reduce risk. The other key data point that I want to point out is there is an 89% efficacy rate with the vaccine for folks between the ages of 18 and 79%. So the vaccines are working for that large an age group. This of course doesn't capture folks who are immunocompromised, but it's an important data point that the vaccines have an 89% efficacy. So I just want to really highlight that particular piece.
Okay, awesome. Well, thank you so much, everyone. That is the last of our questions. Definitely feel free to reach out again to Emma and I or to any of our panelists here, Ronnie as well, as a resource for you guys. And we'll welcome anyone else to say any final remarks. But for the most part, I think that's it. So Thank you so much, everyone.
Also, thank you, Derek, Smita, and Barbara for taking the time to kind of, share more information about college's strategy today.
Could I just put in one quick plug?
Yeah.
Cool. So starting next Thursday, and I'll push this information out in a Dean of Students update, but for folks here, we're going to revive the regular office hours. Last year, it was Jen Kesmersak, Dr. Peluso, and I who were doing them. This year, it will be a rotating cast, but the core group will be Smita, Barbara, and me, joined by other colleagues who have expertise in particular areas. And so we're going to reinstitute that tradition because it seemed to be really well received last year. So watch for more information about that. Open office hours starting again next week.
And I just want to say thank you. I would invite this to be a continual conversation. And we want to partner with SGA and other student organizations to continue this conversation around, how do we as a community, first of all, come together as a community, but also help keep each other safe and healthy. So we want to continue this conversation. I also just want to just express a deep, deep note of gratitude for my colleagues who have been doing this work on this campus for the past almost 2 years and continue to do just amazing work. A lot of it is behind the scenes. A lot of it is one-on-one with students, but they are really, really taking care of our students. So all of the student affairs colleagues on this call, I just really want to say thank you to you and your teams. So thanks.
I guess I'll just add a thank you to all of the students, faculty, and staff in our community taking care of their own health so that we can take care of our community health. It has never been more important. We really appreciate all of the time and dedication folks have put in the past and are committed to putting into the future for us to have a successful year together.
Hear, hear. Thank you, everyone. Enjoy the rest of your evening. Bye-bye, everyone.